Hello everybody, Dr. Marnie Fisher here from Kingsway Dermatology. I'd like to talk about a topic that, of course, as a dermatologist, we all know and love, which is laser season. So typically towards the end of a summer season, when some people might be busy with family matters, reunions, weddings, kids at camp, and a whole series of busy schedules, and then winding it up to get back to on-track scheduling in September. That also sometimes means that the sun is shorter in the day and we talk about laser season. So why do we talk about laser season in the fall? Well, in North America, in Canada certainly, at our latitude, we have longer days and shorter days. And we typically think about the shorter days with less UV exposure on the skin as being a little bit safer for the skin and proceeding with some laser procedures. So that has been a very traditional thought. But if you think about how many aesthetics physicians and aesthetic clinics are run around the world, Saudi Arabia, Mexico City, Brazil, Sao Paulo, Hong Kong, Singapore, Korea, there are a lot of clinics running in equatorial latitudes where the sun really doesn't have a tremendous swing from season to season, and they proceed all year round. So can you do your lasers in the summer? Yes, of course you can. You proceed with caution and you take all the necessary steps to protect your skin, especially if it is ablative, especially if there's a lot of heat trapping afterwards, to protect that extra UV and IR sun exposure on the skin. It's as simple as that. So if the summer season is you can hide out and hovel in the shade and take some downtime and do your laser procedure ahead of time, then by all means go ahead. September, October, November, we get ramped up. We get excited for our lasers to start, however, in Kingsway Dermatology. And that's when we really do recommend getting rid of and shedding those dead skin cells that might have been accumulating a little bit with extra sunscreen application, some extra sweating, some sports, all of those factors that might lead to an interruption in your daily skincare routine. Also, there's some accumulated UV exposure that is going to darken some of the melanin pigment lesions, typically the lentigines of the face, the neck, the décolleté, the arms, the back of the hand. So when we're attacking that particular chromophore, the melanin in, say, a lentigine, which is typically a brown sunspot, then it's the optimal time to do that because we know that the sun in Canada is less and they're not going to bounce back so much. And we get a nice blended, refreshed, radiant skin going into the winter and the gala party season. Some of the lasers that are going to fall into that category of getting ramped up for laser season is IPL or BBL. This is a broad light with filtered out nanometers targeting typically those brown pigments and some red pigments as well. The red pigments meaning the red flush, the red blood vessels, that sort of thing. We're also talking about our Cyton Suite family of Moxie, Profrac, and the Halo, which is either ablative or non-ablative, doing the deep coring and the skin removal that is then promoting collagen regeneration, epidermal regeneration, and all the good things that we know are promoting skin health and anti-skin aging. Sometimes in the clinic here, from a user provider, we talk about energy-based devices rather than just lasers. So an energy-based device from our standpoint also includes all therapy. All therapy uses ultrasound energy, and this is typically not a laser, although many people might confuse it with, say, a laser procedure because it is an energy-based device delivering some energy to the skin. Ulthera does not have a season. So this is remarkable and it's advantageous to many people who may want to then do Ulthera maybe in the summer and then their ablative Halo or Profrac in the winter. Another confusing point is radiofrequency. We have radiofrequency microneedling from Cutera called Secret. A lot of people have not heard of Secret. It's a funny word that they used because it has stayed a secret. But radiofrequency microneedling and microneedling in general can be used all 4 seasons. And this is a tremendous advantage for a lot of people to consider putting in an extra couple of appointments and collagen regenerative stimulating procedures during the summertime to improve and then add on to the backs of, say, the ablative type treatments that they might be pursuing in the wintertime. So maybe a wrap-up statement should say laser season is every season. And really what the max consideration should be, from my point of view, is what is the patient's results-oriented goals and what is their downtime for each individual procedure. So the procedures will dictate how much downtime. We can also fine-tune some of our treatments to minimize that downtime for the patient. So there really is a deep dive discussion that needs to be done in the clinic to really understand what that is. So if somebody comes in for a procedure on Thursday and they want to be ready for work on Monday, that is a very important consideration. A little expert tip is that we are now using exosomes in conjunction, just like we have been using PRP in conjunction after procedure. We've been using PRP after procedure for about 12 years now, but our exosome suite, including the autologous secretomes, improves the healing time, and it is a real winner in terms of getting in your treatments in as little downtime as possible. So another important aspect of laser season is to consider the risk reward, and lasers should be used and energy-based devices should be used to maximize safety and minimize complications. So consider the provider and the expert to deliver that care and then manage those expectations for you. The consult process is very thorough, and it's important to realize that sometimes there needs to be a skin prep to maximize the benefits of the laser treatments. And let me give you an example. Say, for example, somebody comes in with acne scarring and they just want to proceed. They want to do the treatment the same day or the next day. But really what we have to do is analyze the skin. Is it too oily? Is there too much dead skin on the surface, which would impede and impair some of the benefits of that laser? Maybe we want to contain the mature melanin content of the skin before we proceed as well to minimize the risk of post-inflammatory hyperpigmentation. So that typically would take 3 to 4, maybe even 6 weeks of pre-skin conditioning, even before we proceed into considering doing a laser procedure. And this is very important. Okay, so to wrap up, we love lasers. We use them all day, every day. We've been doing laser procedures here for 20 years. Both Dr. Poulos and I did some laser research way back at the beginning. So we've been through all of the different evolutions of lasers, how they're used, the technology, it's getting better and better and better. And we understand the evidence-based science behind them, and we can cut through the fluff to only recommend results-driven care for our patients. So I hope you found this little video helpful. I'm Dr. Marnie Fisher. Comments, questions down below, and thank you for watching.